When the vaccine mandates were rolled out in 2020, one of the most striking things about these policies, which began at universities, was their complete abrogation or just ignoring of the Nuremberg Code. So the Nuremberg Code was developed in the wake of World War II, when eugenics sort of got a bad name, was developed to prevent the kinds of abuses that we saw in Nazi medicine of human subjects, research subjects, being experimented on without their consent, often in ways that didn't benefit them, and sometimes in ways that were downright sort of horrifying and obviously abusive. And the world quite appropriately reacted with horror and developed this landmark of 20th century medical ethics, the Nuremberg Code. And the first provision of the Nuremberg Code is the doctrine of informed consent, that an adult of sound mind should be able to decline an intervention into their own body. And this started out being applied to people who were involved in research trials, but later in federal law, in other codes of medical ethics, was also applied in the clinical setting to medical interventions. And the fact that during the pandemic, we had a vaccine that we knew from very early on did not stop infection or transmission. And therefore, the risks and benefits of this particular intervention would apply to the person receiving the vaccine, but not necessarily influence other people. The doctrine of informed consent should have been at the centerpiece of the mass vaccination campaign. Educate people on what we know, what we don't know about the virus, educate people on what we know, what we don't know about this novel gene therapy, this novel vaccine, and then let people make their own decisions.